Hello, and thank you for joining Ohio University's webinar for our Adult Gerontology Acute Care Nurse Practitioner program. Today we will go over concentration details as well as a career outlook. And of course, if you think the program will be a good fit for you, we will cover the next steps for your educational goals. My name is Serena Garcia, and my role as your enrollment advisor is to ensure you have all of the information necessary in order to be able to make a decision on whether or not this program will be a good fit for you. Joining us today is our Associate Professor and Program Director, Dr. Char, along with our Academic Advisor, Chad Kopenski. Also, Christopher Hilton is another advisor on the program. And now to go over the program overview, Dr. Char and Chad Kopenski will be sharing all the program information.
Hello, this is Dr. Char, and I'm going to talk just a few minutes about an overview of the Adult Gerontology Acute Care NP and what that person in that role might be doing. AGA-CNPs are advanced practice nurses that provide specialized nursing care to adults and older adults. The patient population that they can care for includes adults, that includes those age 13 and up. So they may manage critical as well as chronic conditions, and they may be in a variety of settings that include retirement homes, nursing homes, hospice, both in-home hospice as well as inpatient hospice, hospitals, or some private practices depending on the state in which they are practicing.
My name is Chad Kopenski. I'm the academic advisor for the graduate nursing programs. And one thing I think to be sure of is just understand the difference between an AGA-CNP and an FNP. And I think I'm going to throw it back to Dr. Miller. What is sort of the biggest difference between those two specialties?
Sure, because many of our students are trying to decide what they want to be in their advanced practice career. And if you are weighing the FNP, which has a focus on primary care, so the FNP is a person who's going to be practicing with those in a preventive role and in an ongoing role in a private or in a primary care practice setting. Acute care NPs, the AGA-CNPs, are predominantly going to be practicing in acute care settings, which are likely to be, again, hospitals, certainly emergency rooms. Urgent care, you may see a mix of the two types of providers because there are some issues within urgent care that are really primary care issues that are handled very well by FNPs, but there may also be some more acute care issues that have the requirement for an AGA-CNP.
One of the questions that students often ask is, what is the career outlook for nurses? And there are a number of different sites that you can go to. If you look at the BLS numbers, Bureau of Labor Statistics, you can see that there is expected to be a growth for nurse practitioners through 2026. One thing that I think is really important for people considering going into advanced practice or a master's program for nursing to consider is really the role that they want to take on. To look at some of these websites, shadow a nurse, through these websites, see what those nurses actually do in the course of a given day. They can also look at their state boards of nursing. Many states have adopted the consensus model that does lay out what the roles and expectations are for nurses in those roles. Graduate school really is where you go and you get the education to take that next step. It's not really where you go to figure out what it is that you want to do. And so it's really important to us that prospective students understand the role that they are looking to assume and really ask those questions and really make those, ask those questions of themselves and make those hard choices so that they know exactly what they're getting into and what they're preparing themselves for. Would you agree with that, Dr. Miller?
Absolutely.
Okay.
I would say one of the most common questions that we are asked by prospective students these days is just exactly that. What do I want to do? This is kind of what I have in mind for my career. Is that an FNP appropriate role, or is that an AGA-CNP appropriate role? And the answers to that can be found in those documents that Chad mentioned, the APRN consensus model, certainly your own individual state board of nursing and your advanced practice state organization also is a great place to go for information and also to connect to people who are functioning in those roles. So to APRNs who are prepared as FNPs and as AGA CMPs, it's a great place to connect with those who might be willing to have a student come with them for a few hours and live a day in the life, so to speak. It's a big decision, and it's not one to be made lightly. And the last thing that you or a program wants is for you to get midstream and then realize, oh, wow, this is not what I thought I was going to be doing. So doing a little bit of legwork in the beginning so that you make the very best informed choice is the best way to make sure that you're going to be ending up in a satisfying career and is what you had envisioned.
And be successful in our program.
Absolutely.
Now, starting our program, there's a common set of courses, our core courses, that all of our students take. And you can see them listed here. The theory, the assessment, the EVP course, patho, health appraisal, pharmacology. Those final three courses are what we collectively call our 3 Ps. And those really are requirements for almost all nurses, or all advanced practice nurses. The idea behind this core set of courses is that by taking them over your first 3 semesters, you have a solid basis in the nursing practice before you then refine it once you get into your track-specific courses. This is the basis of advanced practice, which you'll then refine once you get into your track courses, which you probably would think of more as your clinical courses. Is that okay?
The courses that you see on this slide are the AGA CMP concentration curriculum courses, what you would probably think of as the clinical courses, or sort of the meat and potatoes of what are the courses that are going to transform you into an AGA CMP by the end of the program. The first 2 courses that you see listed here are Applied Clinical Pharmacology and Advanced Diagnostic and Procedures. These are really critical courses. You take them prior to beginning your clinical experiences. And in the Advanced Diagnostic and Procedures course, this is all about how to interpret x-rays. When do I order a CAT scan versus an MRI? How do I interpret lab values? And what do those things mean in terms of management? So it's really the foundation for what you'll use for clinical decision making as you go into the clinical courses. That course does include an on-campus OCI, and OCI stands for On-Campus Intensive. It is a 2 to 3 day experience where you come onto one of the Ohio University campuses, either in Athens or in Dublin, and we actually do a hands-on instruction for lots of different skills. That would include things like central lines, things like fluorescentesis, things like lab interpretation, x-ray interpretation, CAT scan interpretation, how to do an ultrasound, how to read an EKG strip, all of those advanced practice skills that you will be utilizing in your clinical practice and in your clinical rotations in the upcoming courses. And then the Applied Clinical Pharmacology course builds on your advanced pharmacology course that you took in the core. And in the core course for pharmacology, what you can expect is going over the classes of drugs that you probably recall from your bachelor's degree, as well as those that you utilize every day as a registered nurse in your practice. But it asks you to take a little step further into understanding the pharmacokinetics, pharmacodynamics, and the prescribing issues that go along with those drugs. Applied Clinical Pharmacology for AGA CMP is about a different type of pharmacology. It's about the pharmacology that we find in acute care settings. In particular, it's about things like IV therapy, IV antibiotics, IV fluids. It's about total parenteral nutrition, or TPN. It's about how do I give, a drug IV as opposed to by mouth. It's about all of the management of the drugs that we see used in acute care that we typically would not see in primary care or in an office setting. And then the clinical courses, so that's AGA-CMP Management of Common Adult Health Problems 1 and 2. Those courses are where you begin your clinical rotations. So you will be working with an approved preceptor in an acute care setting, and you will also have a clinical supervisor who is a faculty person here at Ohio University who oversee that clinical experience and help you to develop into an AGA-CMP and prepare for board certification. In each of those courses, you will be completing clinicals that might be in a variety of settings, but they will all be in acute care type settings. Could be hospital, could be briefly sometime in an internist's office with some rotation into hospital. Certainly will be emergency room, intensive care unit, could be trauma units, burn units, urgent care, and certainly any other kind of specialty emergency room practices that you have access to. And then the AGAC in practice is, again, kind of putting it all together. Again, this is a supervised, precepted clinical with a preceptor as well as a clinical supervisor. And you are completing the polish on your practice as a novice AGA-CMP. So the focus in that course is really about those things that are absolutely critical to being an APRN. It'll be things like, in Ohio, we require a standard care arrangement with a physician in order to practice. So we review those kinds of issues as well as other clinical issues like issuing, how do I get issued a DEA number in order to prescribe, talking about licensing, certification, and all of the requirements then to maintain that. And then the capstone experience is the course that you take concurrently with AGA-CMP in practice. The focus of that course is on the development of a program portfolio, which basically is your way of documenting having met all of these standards within our program, as well as those that are required for national accreditation and certification. So you are pulling artifacts, is the term that we use, but those are basically your graded assignments from throughout the program, and you pull those all together into a digital portfolio. You also pull reports from your clinical experiences, which we can do in graphical or narrative form. And you will document your experience and your having met those specific standards and competencies. There is also an OCI that accompanies that course. That on-campus intensive involves doing work with standardized patients. So you will have a multi-patient simulation. So it will basically simulate an ICU or an ER type setting where you have multiple patients to manage care for. You will have a specific amount of time to provide the care, the management, the decision-making, and the documentation for those cases. It really is a fantastic experience for students and faculty to see how far you've come and to sort of put you through your paces as, again, a novice AGA-CMP and preparing for that transition to practice.
Dr. Miller, if it's okay, there are two questions I always get asked by prospective students, and I want to ask you those questions. The first one that I always get is, can I work full-time and do my clinical courses? Well, the answer is maybe. What we find with most of our students is that when they are coming into the program, most of them are working full-time. In fact, about 70% are working full-time. And most of them are able to maintain that through the core courses time. So during the first 3 semesters, most students find that they're able to maintain their employment that they had upon program admission without too much trouble. In the second year, or in the clinical year, when you start those track-specific courses, then it becomes a little bit more challenging, mainly in the clinical courses, because you do have a total of 650 clinical hours to complete, and you have to fit that into, your 7 days a week, and 7 days a week just doesn't get any bigger, no matter how busy that you get. So if you are working 5 days a week and you need to do clinical 3 days a week, that doesn't compute. So it depends on what your job responsibilities are and what your schedule is.
most students have found, I believe, the ones that maintain full-time employment are those who are able to work something like a 3 12-hour shift week, or they take advantage of things like their paid time off or their vacation time and take those days off accordingly during the clinical year. But I would say we drop down to about half of the students are able to maintain full-time employment or the same level of employment that they did upon program admission during the clinical year.
And the second question that I always get asked is, do you find my clinicals for me, or will you help me find my clinical placements?
And the answer to that is that we do provide assistance in locating appropriate clinical sites. We do have a database that students can access that lists potential preceptors. We also have a clinical coordinator who is able to help students navigate that process. We do not assign preceptors at this time, so you don't come into the program and you are automatically assigned to a preceptor. We do allow students to locate approved preceptors in areas that are convenient to them. So if you know of providers or you know practices where you would like to have clinical placement, we are able to accept your application or your preceptor packet. We then investigate, make sure that the credentials and the site are appropriate, and approve those. So I guess we're trying to blend the best of both worlds. We are certainly able to give assistance for placements, but we are also willing to accept placement applications for students who have access to preceptors close and convenient to them.
And we do talk about that at orientation, so students are able to get most of their information and start early if they choose to do that. Okay, so now taking the next step. Advanced practice nursing is an absolutely exciting career. It is absolutely valuable. You know this as nurses. You know how wonderful it is to come home at the end of the day knowing that you have truly helped somebody and absolutely affected their lives. There's no greater feeling than that. There really isn't. To know that you absolutely made a difference. If you're looking at taking this next step in your career, please do the research, ask your questions, talk to your family members, talk to your coworkers, talk to those who are in the profession, and make sure that this is, for you, the right choice, the right time. And then take the steps and apply. We look forward to working with you. We look forward to seeing you be successful through this program and on your journey. We look forward to helping you take that next step in your career. Best of luck.
Thank you so much, Chad and Char, for sharing all the information. Now what I'd like to do is just go over some of our admission requirements. As you can see, if you live in one of the 6 states below, Ohio, Kentucky, West Virginia, California, Michigan, or Indiana, you can go ahead and start applications. If you do not live in one of these 6 states and would love to be considered when we are, please feel free to reach out to me, and I'll be happy to update you when the state becomes available. Also, you want to make sure that you have a MSN from an accredited college or university and that your GPA is above a 3.0 along with an unrestricted RN license. For assistance with getting started with an application, please feel free to reach out to myself, Serena, or Chris Hilton, your other enrollment advisor, for assistance with the admission process. To complete an application, you'll just need to request all of your transcripts from all colleges you've attended. You need an updated current professional resume, a professional goal statement, 3 recommendation letters, and then there's a $50 application fee at the end. Again, as your enrollment advisors, Christopher and I will be happy to assist you with the process. Feel free to reach out to us. Please keep in mind that we do not offer all of our programs every single semester. We do offer the Family Nurse Practitioner program every semester for spring, summer, and fall. Our Nurse Educator program is only offered in the spring semester. Our Psychiatric Mental Health Nurse Practitioner program is offered every summer, and Adult Gerontology Acute Care Nurse Practitioner is offered every fall semester. Again, for assistance, please don't hesitate to reach myself, Serena, or Hilton for assistance.